You don't want to mess with this disease. Psoriasis is not your average skin condition. It's like the weather, unpredictable, often showing up uninvited and without warning. Imagine your skin deciding to rebel against you, creating a spectacle on your arms, legs, or even your face with red, scaly patches that itch, burn, and sometimes hurt. But it's not just about the skin. This trickster of a condition brings along friends you didn't know you didn't want, like arthritis, heart disease, and a roller coaster of emotional turmoil. And when it comes to treatment, it's like shooting arrows in the dark, hoping one hits the bullseye. Psoriasis isn't just a disease. It's a journey through uncharted territories, making it a formidable foe you'd rather not face. In this video, we will talk about psoriasis, what it is, how and why it happens, signs and symptoms with complications as well as treatment both medical and alternative. We will also discuss the types as well as how it affects sex life, so sit tight and watch this video to the end and do not forget to like and subscribe to the channel. For those that are new to the channel, I am V and welcome to the best health channel on YouTube where we talk about everything related to your health and well-being. Before we go further, we need to really understand what psoriasis is. Psoriasis is a chronic autoimmune condition that primarily affects the skin, but its impact can go beyond just the surface. It's marked by the rapid buildup of skin cells that leads to the formation of thick, red patches, or plaques, which can be covered with silvery scales. These patches often appear on the elbows, knees, scalp, back, face, palms, and feet, but they can show up on other parts of the body as well. At its core, psoriasis is the result of an overactive immune system. Normally, skin cells grow and shed over the course of a month. However, in psoriasis, this process is significantly accelerated, and skin cells can turn over in just a few days. This rapid turnover doesn't give the cells enough time to shed, leading to the buildup that forms the characteristic plaques. Understanding psoriasis is crucial for managing it effectively. While there is currently no cure, treatments are available that can significantly reduce or even temporarily clear the symptoms. These treatments aim to slow down the growth of skin cells, reduce inflammation, and smooth the skin, and they range from topical creams and ointments to light therapy and systemic medications. Moving on to the causes and risk factors, you need to pay attention to this. Psoriasis is influenced by a complex interplay of factors that contribute to its onset and flare-ups. Understanding these causes and risk factors is crucial for managing the condition effectively. Here's a detailed breakdown: genetic factors. Yes, if you have been watching my videos, you will understand that most diseases are genetic. This is why you should be careful with who you marry to save your children from too much suffering. It is better that a single parent have a disease than both parents have it. It increases the chances of the children getting it, so go for that genetic counseling before marriage. Psoriasis has a strong genetic component. If one or both parents have psoriasis, the likelihood of their offspring developing the condition increases. Multiple genes are involved in psoriasis, which contribute to the immune system's dysfunction that characterizes the disease. Immunological factors. Autoimmune response. Psoriasis is classified as an autoimmune disease, wherein the immune system mistakenly attacks healthy skin cells. This leads to an overproduction of skin cells, inflammation, and the resulting plaques. Environmental triggers. Certain infections, especially streptococcal infections, like strep throat, can trigger psoriasis, particularly a type known as Guttate psoriasis. HIV and other viral infections can also exacerbate the condition. In skin injury, there is a phenomenon, known as the Koebner response, that occurs when psoriasis develops at the site of skin injury, such as cuts, scrapes, bug bites, or severe sunburns. High stress levels can trigger or worsen psoriasis flare-ups, likely due to the body's stress response affecting the immune system, so rest. Certain medications can trigger psoriasis or exacerbate existing symptoms. These include beta blockers, used to treat high blood pressure, lithium, used for bipolar disorder, and anti-malarial drugs, among others. Cold, dry weather can lead to psoriasis flare-ups by drying out the skin. Conversely, warm, sunny climates tend to improve symptoms for many individuals. Tobacco use and heavy alcohol consumption have been linked to an increased risk of developing psoriasis and may also exacerbate the severity of the disease. Obesity. Higher body weight is associated with an increased risk of psoriasis, and plaques may develop in skin folds. Weight loss can improve the effectiveness of psoriasis treatments. Other risk factors. Hormonal changes. Psoriasis can flare up during periods of hormonal change, such as puberty and menopause, indicating that hormones may play a role in the condition. Diet. While direct links between diet and psoriasis are still under investigation, some individuals report that certain foods and beverages trigger their psoriasis symptoms. You need to understand that these factors also cause flare-ups in individuals who already have the disease. Understanding these risk factors and triggers is essential for individuals with psoriasis, as identifying and managing them can help reduce flare-ups and control the severity of the disease. Lifestyle modifications, alongside medical treatment, play a critical role in managing psoriasis effectively. Psoriasis manifests in several different forms, each with its own set of characteristics and patterns. Here are the primary subtypes of psoriasis: plaque psoriasis, psoriasis vulgaris. This is the most common form, affecting about 80–90% of people with psoriasis. It features raised, red patches covered with a silvery white buildup of dead skin cells or scale. These patches, or plaques, can appear anywhere on the body but are most commonly found on the scalp, elbows, knees, and lower back. Plaques can be itchy and sometimes painful. When severe, the skin around the joints may crack and bleed. Guttate psoriasis. Guttate psoriasis is often triggered by a bacterial infection, such as strep throat. It is characterized by small, dot-like lesions that appear mainly on the torso, limbs, and scalp. This subtype is more common in children and young adults and can be the first indication of psoriasis in someone who has not previously shown symptoms. Inverse psoriasis, flexural psoriasis. Inverse psoriasis shows up as very red, smooth, and shiny lesions that occur in skin folds, such as under the breasts, in the armpits, or around the groin and buttocks. This type of psoriasis can be particularly uncomfortable due to its location in sensitive and moisture-prone areas, leading to irritation and rubbing. Pustular psoriasis. Pustular psoriasis is marked by white pustules, blisters of non-infectious pus, surrounded by red skin. It can be localized, commonly on the hands and feet, palmoplantar pustulosis, or generalized over large areas of the body. The pus inside the blisters is made up of white blood cells and is not infectious. This subtype can also cause fever, chills, severe itching, and fatigue. Erythrodermic psoriasis. The least common type, erythrodermic psoriasis, can cover the entire body with a red, peeling rash that can burn or itch intensely. It is a severe form of psoriasis that can be life-threatening, especially if it leads to significant temperature fluctuations in the body. It may be triggered by severe sunburn, corticosteroids, and other medications, or by another type of psoriasis that is not well controlled. Psoriatic arthritis. Yes, arthritis, and not just a skin condition. Psoriatic arthritis affects the joints, causing symptoms of arthritis such as pain, stiffness, and swelling. It can affect any part of the body, including fingertips and spine, and can range from relatively mild to severe and disabling. It may cause joint damage that can be severe and permanent if not diagnosed and treated early. Understanding these subtypes is crucial for proper diagnosis and treatment, as each type can respond differently to various therapies. Psoriasis symptoms can vary widely from person to person and depend on the subtype of psoriasis. However, there are general patterns in how symptoms may develop, from early signs to more advanced stages. Here's an overview of how these symptoms can progress. Early symptoms. Mild itching. Initially, the affected areas of skin may start to itch. This is often one of the first signs that a person might notice before any visible changes occur on the skin. Small scaling spots, especially in cases of Guttate psoriasis, small, dandruff-like scaling spots may appear, particularly in children and young adults. Red patches of skin. The development of small, red, inflamed patches on the skin is a common early sign. These patches may be few and localized initially. Developing symptoms. Silver white scales. Over time, the red patches may become covered with silvery white scales, dead skin cells. These scales can be flaky and easily disturbed, leading to skin shedding. Increased itching and burning. As the patches grow in size and thickness, itching and burning sensations may become more pronounced. Dry, cracked skin. The skin around and within the plaques can become very dry and prone to cracking, sometimes causing bleeding. Advanced symptoms. Thickened skin and bold plaques. With the progression of the condition, plaques may thicken and become more pronounced. They can merge to cover large areas of the skin. Painful, swollen joints. In cases where psoriatic arthritis develops, joints may become painful, swollen, and stiff, affecting mobility and daily activities. Nail changes. Psoriasis can affect fingernails and toenails, causing pitting, abnormal nail growth, discoloration, and even nail detachment from the nail bed. Severe itching and pain. Advanced stages of psoriasis can lead to severe itching and pain, impacting sleep and quality of life. Erythrodermic psoriasis. In rare cases, psoriasis can escalate to erythrodermic psoriasis, characterized by widespread redness, severe itching and pain, and peeling rash over large areas of the body. Late complications. Psychosocial impact. The visible nature of psoriasis can lead to significant emotional distress, including low self-esteem, social isolation, and an increased risk of depression and anxiety. Increased risk of comorbidities. Individuals with psoriasis are at a higher risk of developing other health conditions, such as cardiovascular disease, metabolic syndrome, and other autoimmune diseases. Can it affect your sex life? Yes, it can. Psoriasis can significantly affect an individual's sex life through physical discomfort, emotional stress, and psychological challenges. Painful or sensitive skin plaques, especially in sensitive areas, can make sexual activity uncomfortable. Emotional effects like self-consciousness, anxiety, and depression due to visible symptoms can impact body image and sexual desire. These issues may lead to communication challenges and tension in relationships, potentially causing sexual dysfunction. Addressing the impact of psoriasis on sex life involves open communication with partners, effective medical management of symptoms, and seeking counseling or therapy for emotional support. Education about the condition for both individuals and their partners can also help alleviate misconceptions and improve intimacy. It's important to note that not everyone will experience all these symptoms or progress to advanced stages. Psoriasis can remain mild in some individuals or fluctuate in severity over time. Early diagnosis and treatment can help manage symptoms and prevent progression to more severe stages. Managing psoriasis involves a combination of medical treatments and alternative therapies. The choice of treatment depends on the severity of the condition, the affected areas, and how the patient responds to specific treatments. Here's an overview. Medical treatments. Topical treatments. Corticosteroids, the most common initial treatment for mild to moderate psoriasis, reducing inflammation and itching. Vitamin D analogs. These compounds, e.g., calcipotriene, help slow skin cell growth. Retinoids. Topical retinoids, e.g., tazarotene, can help control skin cell growth but may cause skin irritation and increase sensitivity to sunlight. Coal tar, an older treatment that can reduce scaling, itching, and inflammation. Salicylic acid, helps with the shedding of psoriatic scales. Phototherapy, light therapy. UVB phototherapy, exposure to ultraviolet B light in controlled doses can slow skin cell growth and alleviate symptoms. PUVA involves taking a light sensitizing medication, psoralen, before exposure to UV light, used for more severe cases. Systemic medications. Oral or injected medications, used for severe psoriasis or when other treatments are ineffective. Includes methotrexate, cyclosporin, and acitretin. Also, note that medications like methotrexate, while highly effective, can cause liver issues, so make sure you talk to your doctor about it before taking. In most cases, you may be required to take it alongside hepatoprotectors. Biologic treatments. Targeted therapy. Biologics are drugs derived from living organisms that target specific parts of the immune system responsible for inflammation in psoriasis, such as TNF-alpha inhibitors, Illinois-17 inhibitors, and IL-12/23 inhibitors. Alternative treatments. Dietary supplements. Fish oil, vitamin D, and probiotics. Some people with psoriasis find relief by adding these supplements to their diet, though the evidence is variable. Herbal remedies. Aloe vera, turmeric, Oregon grape, applied topically. These may reduce inflammation and soothe the skin, but more research is needed. Diet and lifestyle changes. Anti-inflammatory diet. Some patients benefit from a diet rich in fruits, vegetables, lean proteins, and whole grains, which can reduce inflammation. Weight loss. For those who are overweight, losing weight may help reduce the severity of symptoms. Stress management techniques. Meditation, yoga, and Tai Chi. Stress is a known trigger for psoriasis flare-ups. These practices can help manage stress levels. I can't recommend these enough. They have helped me a lot in managing stress. Moisturizers for skincare. Regular moisturizing. Keeping the skin hydrated can help reduce dryness, itching, and scaling. Combination therapy. Often, a combination of treatments, e.g., topical treatments along with phototherapy, is more effective than a single treatment. The choice of therapies should be personalized, taking into account the patient's specific condition, lifestyle, and preference. Monitoring and adjustments. Treatment effectiveness varies widely among individuals, and what works for one person may not work for another. Regular monitoring and adjustments by a healthcare provider are essential to find the most effective management strategy for each individual. It's important for patients to consult with a healthcare provider before starting any new treatment, including alternative therapies, to ensure they are appropriate and won't interfere with existing treatments. As we wrap up this video on psoriasis, it's essential to recognize the resilience and courage of those who navigate this challenging condition every day. Psoriasis is more than just a skin disorder. It's a battle with one's own body, a test of strength and patience, and an ongoing quest for acceptance and understanding. To all of you who've been with us till the end of this video, thank you sincerely for watching. Your time and attention mean the world to me, and I hope this segment has not only enlightened you but also offered hope and solidarity to those living with psoriasis. If you found value in my video today, please don't forget to like and subscribe to our channel. Your support helps me continue to bring important topics like this into the spotlight. And let's not forget the crucial message psoriasis teaches us about the importance of taking care of our bodies. In a world where we are often pulled in multiple directions, neglecting our well-being can be easy. However, nurturing our body, listening to its signals, and responding with care and kindness can make a profound difference in our quality of life. Whether it's through nutrition, exercise, stress management, or seeking timely medical care, every positive action we take for our body is an investment in our future health and happiness. Remember, your body is your most precious companion on this journey through life. Treat it with love, respect, and care, and it will reciprocate in ways that empower and uplift you, even through the challenges of conditions like psoriasis. Thank you once again for being a part of this meaningful dialogue. Together, let's spread awareness, foster understanding, and build a supportive community for all those affected by psoriasis and other chronic conditions. Take care of your body, and it will take care of you.